Right. Hello, everyone. So today we're going to be lecturing on chapter 14 here, which is on the autonomic nervous system. So autonomic, this is what happens automatically. You don't have to provide any input to this. It's just regulating everything going on in your body, from sweating to increasing and decreasing your heart rate to digesting. Tons and tons of processes occurring in your body at all times are happening automatically, and it's via this autonomic nervous system. I've hinted at this the past few lectures, but now we get to finally talk about it in detail. So, overview here of this chapter. It's not, even though it looks like it's a lot, it's not a crazy, crazy long chapter. Again, this is all involuntary. It's maintaining homeostasis in your body and helping keep you alive. So we're going to look at how it differs from the somatic nervous system, which is the voluntary control. And then we'll look at the two main branches of the autonomic nervous system. We have the parasympathetic division and the sympathetic division. We'll talk about where their names come from, what they mean. So this is fight or flight. This is rest and digest. And then we'll look at how they work through visceral reflexes. Then we have to look at kind of what regulates it. How do we speed up a heart rate? How do we slow down a heart rate? This is all comes down to things like neurotransmitters and the receptors they bind to. Some neurotransmitters can be excitatory or inhibitory, and it all depends on whether or not they're causing a depolarization or hyperpolarization of the cell they're communicating with. If they're causing a depolarization, they're going to send a signal. If they're causing a hyperpolarization, it's going to prevent a signal and be inhibitory. So then we're going to look at how those divisions interact. Sometimes they work together for certain things, and sometimes they are more antagonistic to each other. And then how does the central nervous system control the autonomic? So higher order centers controlling the output. So we'll look at that as well. And then when things go wrong. So here, autonomic nervous system, we're finally down into the last little branch of this table here, where we're looking at the sympathetic versus the parasympathetic divisions. Again, these are all involuntary inputs, so sometimes called the involuntary nervous system or general visceral motor system. And this is all via subconscious controls. Thankfully, we don't have to sit there and say, please digest dinner. It just happens. So these are going to smooth muscles, cardiac muscles, and glands. Now let's compare the autonomic with the somatic. Remember, the somatic is the voluntary nervous system. So both have motor fibers. So both have an output, but they differ in the effectors. Remember, effectors are those outputs. So the efferent pathways and the ganglia differ. So for the somatic system, that motor neuron went directly to the muscle. In the autonomic, or ANS, the effector neuron actually synapses in a ganglia prior to going all the way out, or it can synapse closer to the effector organ, but typically they are two neurons to get there, whereas motor fibers for the somatic nervous system is one neuron. So one neuron compared to two neurons. So the target organ then responds to neurotransmitters rather than that electrical signal getting there. And then effectors here, effectors in somatic nervous system innervate skeletal muscles, autonomic innervates cardiac muscle, smooth muscle, and glands. So they go to slightly different places. And then here, just terminology-wise, we want to get this terminology down here. So somatic nervous system, cell body is in the central nervous system. So that's what the gray matter is in your spinal cord. So there's little interneurons in there. That's where the cell bodies are. Then it goes out one thick myelinated group A axon, so the signal travels very fast all the way to the skeletal muscle. It innervates. Autonomic, again, uses a two neuron chain. Now each of these neurons have a name that goes with it. The neuron number one is the preganglionic neuron. Neuron number two is the postganglionic neuron. So the preganglionic neuron comes out of the central nervous system. So this would be like the somatic neuron. However, there's now a synapse here. This is called an autonomic ganglia. Remember, a ganglia is a cluster of cell bodies outside of the central nervous system. A nuclei is a cluster of cell bodies within the central nervous system. So this preganglionic neuron synapses here. This is called an autonomic ganglion, and then becomes the postganglionic neuron and sends its signal to the effector organs. Could be cardiac muscle, smooth muscle, glands, or adipose tissue, which are fat tissues. So that's just the general features of the autonomic nervous system, but you have to understand preganglionic neuron versus postganglionic neuron, because there are differences when we start separating it between parasympathetic versus sympathetic. So here, neurotransmitter effects in as well. So somatic nervous system, all motor neurons release acetylcholine. So at the muscles, we talked about that in the muscles chapter. So acetylcholine binds to acetylcholine receptors, causes muscle contraction. Effect is always stimulatory. But in the autonomic nervous system, all preganglionic fibers release acetylcholine. So these, like I said, are similar to these, except it takes a two-step process. So these first ones still release acetylcholine, but then the postganglionic fibers can release either norepinephrine or acetylcholine at the effector. So it differs based on which type it is. So the effect is either stimulatory or inhibitory depending on the type of receptors. Later in this lecture, we'll talk about the differing receptors and what makes them excitatory or inhibitory. So now some overlaps higher brain centers do regulate, so we'll talk about that later, and they coordinate both systems. Most spinal and many cranial nerves contain both somatic and autonomic fibers. Remember, the lateral horn in the spinal cord is where the autonomic nervous system exits. Adaptations usually involve both skeletal muscles and visceral organs. So we have to get more oxygen to active muscles, so autonomic nerve speeds up heart rate and opens airways. So these things do work together. So then this is the main study image for this chapter. You want to make sure you can understand this image because this compares everything. Now we're going to break it down. Just first here, I want to remind you of the somatic nervous system here. So this would be the cell body in the central nervous system. So this would be, the interneuron here in the ventral horn that then comes out. It's a heavily myelinated axon, a single neuron, goes to the effector organ like the skeletal muscle, releases acetylcholine, and it's always stimulatory. Now, autonomic nervous system. Here we're comparing sympathetic versus parasympathetic. We're going to break these down, but I just want to give a general overview here, looking at this division and what the two arms do. First thing we see here, we want to look at the similarities. So here's an axon, here's an axon, here's an axon. These are all the preganglionic axons. In a sympathetic system, sympathetic is fight or flight, these axons are lightly myelinated and short. In the parasympathetic system, these are lightly myelinated and long. So here, if we would switch to the pen just to write some notes on here. So short, long. So here then we're comparing sympathetic versus parasympathetic, and these are some of the big differences between them, and that could get you twisted up if reading a multiple choice question. Now, one unique feature, we release acetylcholine here. We release acetylcholine at this preganglionic neuron. We release acetylcholine at this preganglionic neuron, and we release acetylcholine at this preganglionic neuron. So everything releases acetylcholine after that first neuron leaves the central nervous system. Now it depends on what happens. So here there are two different types of neurons in the sympathetic system. Some goes directly to a ganglion. So we have what's called a sympathetic trunk, or there can be collateral ganglia, which we'll talk about later. The synapse here releases acetylcholine, then activates the next postganglionic neuron, sends its signal out. Now this one is non-myelinated, so it's like your gray matter. The signal doesn't travel as fast. This one also releases all these post-ganglionic neurons, release norepinephrine. Except there's one. So when I say all post-ganglionic neurons of the sympathetic nervous system release norepinephrine, there is one with an asterisk, sweat glands release acetylcholine. So one slight difference here. But in general, so you might want to write that asterisk in your notes that all post-ganglionic sympathetic neurons release norepinephrine except sweat glands release acetylcholine would be the full sentence for that. And then here, so here's this one. Now, remember the adrenal medulla is it's kind of like a misplaced ganglion. It's a gland, so release acetylcholine into here. That release of acetylcholine causes the release of epinephrine and norepinephrine, which then flows into the blood and then can have its effect throughout the body. So slightly different form here for that postganglionic neuron. It's not really a postganglionic neuron. It just releases the norepinephrine from blood vessels stored in here, from vesicles stored in here. And then, not blood vessels, but cells stored in there. It just releases it into the blood vessels. Sorry, getting tongue-tied. And then parasympathetic, short, postganglionic. So here post is also the short, and then these post ones can be long. It doesn't really show it there, but generally they are longer than the preganglionic ones. And it's interesting they're longer because they're also non-myelinated, so the signal doesn't travel as quickly as well. But here, back to the parasympathetic, long preganglionic, short postganglionic. So these ganglions are much closer to the organ they innervate. And we'll see that when looking at the differences here. So then these short ones, again, non-myelinated, postganglionic, and these ones all release acetylcholine. So postganglionic parasympathetic fibers release acetylcholine. The main difference to remember here is the sympathetic release norepinephrine. So these go into smooth muscle, glands, cardiac muscle, and they can either be stimulatory or excitatory, and it all depends. So here, acetylcholine, if that affects the heart, it is actually an inhibitory effect because of the receptors it binds to. All right, so like I said, this image can summarize this whole chapter pretty much. So if you can understand everything going on in this image, you're off to a good start in studying for this chapter. So now just to look at the words about all this. So here, two arms of the autonomic. We have the parasympathetic and sympathetic division. Parasympathetic, rest and digest, conserving energy. Sympathetic is fight or flight, mobilizing you during activity. So these do work together so that all visceral organs are served by both divisions. So things can speed up your heart rate, things can slow down your heart rate. So there's a dynamic antagonism between the two divisions, and that maintains homeostasis. So now, focused on the roles of the parasympathetic first here. So body energy as low as possible. Oops, I didn't want to do this. Let's restart this here. I hit a button. There we go. So role as a parasympathetic. So keeping the body energy high and helping for rest and digest. So body and energy use, not body energy high, but the storage high. So body energy use is low to keep the storage high. So maintenance activities, so directs digestion, diuresis, defecation, referred to as rest and digest. So if you ever think parasympathetic, I'll say it all the time, but the rest and digest system. So after you eat a meal, your blood pressure, heart rate, and respiratory rates are low, and GI tract activity is high as well. Pupils are constricted, lens accommodated for close vision. So here, pupils constricted for close vision. And then sympathetic, this is the fight or flight system. So the quick acting system. So exercise, excitement, emergency embarrassment activities activate sympathetic system. So increasing heart rate, dry mouth, cold, sweaty skin, dilated pupils. So compared to pupils constricted. So remember, constricted pupils, parasympathetic. Dilated pupils, sympathetic. And this is also a response, like if you ever, let's just say you've seen it happen. It hasn't happened to yourself, so you get pulled over at night. The officer shines that bright light into one of your eyes. What he's looking for is your autonomic response to that light input. If it's too slow, so causing dilation constriction of your pupils, if it happens too slow, it suggests that something is affecting your nervous system speed, that something could most likely being drugs or alcohol. So that's a simple test to see this autonomic response and what happens to your pupils and how fast they change. It gives the officer an indicator whether to test the individual further, but it's not completely in agreement with what could be wrong with the individual. But during physical activity, then, this also shunts blood to skeletal muscles in the heart, dilates the bronchioles to get more flow coming in, and then causes the liver to release glucose for energy as well. So three main differences between the two. The first one here are the sites or the origin. So parasympathetic fibers are craniosacral. We'll see this coming up. And this is where it gets its name too. So sympathetic, think middle, para, next to. So craniosacral, sacral, meaning parasympathetic arise from the cranial region and the sacral region. Sympathetic fibers are thoracolumbar, so from the thoracic region, and some in the lumbar region. So you can picture that. I'll show the images coming. The next slide shows the separation, but that's how they get their name. So parasympathetic or sympathetic, it gets its name mainly based on where it's located. And then the lengths of fibers. I talked about this one. Parasympathetic has long preganglionic, short postganglionic. Sympathetic has short preganglionic, long postganglionic. And then the location of the ganglia also differ. Parasympathetic are located near their visceral effector organs. Sympathetic are close to the spinal cord and something called the sympathetic trunk. So here, this is showing the difference between para. So this is craniosacral. Now remember that one cranial nerve that comes below the neck. Anyone remember what this one is called? Learned it last chapter when talking about the cranial nerves. That's vagus nerve. So an important nerve innervating all these organs below, and that's part of the parasympathetic division. I might have hinted at that last chapter, so this is a little refresher on it. And then sympathetic, thoracolumbar. So here's the thoracic region, here's the lumbar region. These all then innervate in this trunk feature here. This is called the sympathetic trunk, and I'll talk about this more later. And so here, short preganglionic and long postganglionic fibers, long preganglionic, short postganglionic fibers. So these ones have ganglia that are pretty much right on the effector organs. These ones have their ganglia in the sympathetic trunk. Some of these ganglia can be outside that sympathetic trunk. And those are called collateral ganglia. We'll talk about some of those as we go through this. So parasympathetic here, also known as the craniosacral division, because that's where it is. Again, long preganglionic fibers extend from the central nervous system to almost right to the target organs. And a synapse with the neurons and terminal ganglia that could be on or within the organ, and then short postganglionic fibers and synapse with whatever the effectors are. So just looking at some of these here, so looking at, so the ganglia are named based on pretty much where they are. So we have the ciliary ganglia, the pterygopalatine ganglia, and just showing some different innervations, submandibular, otic ganglia, cardiac, and pulmonary plexuses, which then form ganglias near the heart, the lungs. Down here's the celiac plexus. Some also go to the, that branches, one goes to the gallbladder, one to the liver. There's one on the stomach, the pancreas, and multiple ones on the intestines. And then down here in the sacral division, then go to the gonadal regions and the bladder. So we're not going to go through all of these, but this nerve coming out right here is that vagus nerve. Which is on the next slide. But here, so all these are part of the cranial nerve. So here, ocular motor is nerve 3, facial nerve, and glossopharyngeal nerves. And if you remember, if you go back to that lab we did going over the cranial nerves, I wrote a parasympathetic next to some of them, and these are the ones I wrote them next to. And then the last one, again, is that vagus nerve. Number 10 here accounts for 90% of all preganglionic parasympathetic fibers in the body. So everything that comes out of this region here is going downwards. So here serves all thoracic and abdominal viscera. Cardiac plexus is what slows the heart rate. Pulmonary plexus serves lungs and bronchi. Esophageal plexus, everything's working together. I'm not going to go through each ganglia and whatnot. They're kind of, we get the names down by this point of where they go and what they do. And then the sacral part here comes from between S2 and S4. So they going through the ventral roots of the spinal nerves, and they branch off to form the pelvic splanchnic nerves. These can go to the bottom of, so this would be the sigmoid colon and the rectum down there, and these then form the pelvic floor. But we're not going to go too much more detail on that. Mainly the focus of this is to know that parasympathetic arises from 4 different cranial nerves and also a couple different sacral nerves, whereas sympathetic can be arising from this region here. So let's look at sympathetic now. So more complex, innervates more organs. So these are also called the thoracolumbar division, and then the preganglionic fibers pass through white rami communicants. I hinted at these last chapter, and I said we'd get to those this chapter. And they enter the sympathetic trunk, chain, or paravertebral ganglia. So they come through, they synapse, and then they go back out. So then there's white rami communicants, and then there's also gray rami communicants. So there are 23 paravertebral ganglia in the sympathetic trunk. And I'll go over these ganglia and show kind of how they're located when looking at the lab component of this lecture. That video will be posted a little later. So here are the sympathetic trunk ganglia. So they follow, thoracic and lumbar region of your vertebrae. And now, so there are 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, and 1 little coccygeal one. So if I was a signal exiting here, so switching back to the pen, remember the autonomic system exits the lateral horn. So it would come up here, come out one of these spinal roots. And then what it does is it travels out. So this is the ventral root right here. Remember, dorsal root is where the sensory input is coming in. So the sensory input isn't really considered part of the autonomic system. It kind of starts right here where it comes out the ventral horn. And then, so this would be the preganglionic fiber I'm drawing right now. This would be the cell body back here. Oops, stop popping up. That would be the cell body. Preganglionic fiber comes out. So this is myelinated. So this actually then comes down the white rami communicates. And this is called the white rami communicates because, or white ramus communicans, because it's myelinated. It then synapses in the sympathetic trunk ganglion right here, and then it can do a couple different things. We're going to talk about the different options it has. It could go right back out, and then it goes out to gray ramus communicans, and then it can go back out this way. So that's option 1. Option 2 is that it can come down or go above to another ganglia, synapse there, and then go out the gray rami communicans and out that way. So that'd be option 2. So these signals can go out and then up and down the sympathetic trunk very quickly to where they need to go then. And then option 3, you can't draw on this image here, but it can come down and then go out and go to a collateral ganglia. But we'll see that on a future image. This one just doesn't have the collateral ganglia on it to show it. But so they don't synapse here. They would just imagine we're a signal coming out to this one right here, coming out, and then let's say they go down and then back out and then all the way out to another ganglia that's out here, and that's where the synapse finally happens. So here, I just mentioned these, so the different things they could do. They could synapse in the trunk ganglia, they could synapse with the same trunk, or they can ascend or descend to another trunk, or they can synapse in those collateral ganglia. If they synapse out there, they synapse outside of the trunk. This is only in the abdomen and pelvis. So here is the better version of the image. So, but some things I wanted to focus on here. This is the lateral horn, comes out, and then comes at the white ramus, synapses, goes back out to gray, and then back out. So that's the first thing that could happen. Or it can go up, synapse, and out. It can go down, synapse, and out. Or it can go straight through or straight down and through and go to this collateral ganglia right here, synapse, and out. Liver, spleen, adrenal glands, stomach, intestines, kidneys, urinary bladder, reproductive organs, all examples of things that could go through this. So just 3 different possible pathways for these ganglia. And then here is shown, so these postganglia, just a couple different examples here. Okay, we have the signal coming out, coming through, synapses, and then this gray ramus, then has it go all the way to things like skin, so the erector pili muscles and sweat glands. So just an example, so how one could synapse in the trunk ganglia at the same level and go to that same ganglia. So these fibers innervate sweat glands, erector pili muscles, and vascular smooth muscle via pathways to the head and thorax. Or they can come out, ascend, and go out. So they could synapse in a trunk ganglion at a higher or lower level, and then effectors could be blood vessels or the skin again. So it all depends. So you can have multiple different pathways going to the same organs. And then here, there are some pathways to the head. That would make sense. You still need to have some sympathetic responses in your head. So even though we are thoracolumbar here, synapse can then come up, and then I'll highlight it in the lab when looking at it in 3D organon, but we have this superior cervical ganglia, and that's where all these synapses occur that can then send signals to the head and so forth. So salivary glands and whatnot. And then there are some other cervical ganglia which then go to the heart, lungs. Here are the abdominopelvic ganglia. So this is the celiac ganglia. There's a superior and inferior mesenteric ganglia. So a couple different ganglia that we have down here. So I just talked about all these and where they could go. This kind of shows it. Now, some of these aren't on the program. I'll be showing you later as well. But again, think of anything that's required for the fight or flight response. This is where they go. So then here, so most fibers from T5 to L2 synapse and collateral ganglia outside the trunk, forming what are known as those splanchic nerves. So if we go back here, these are so a greater splanchic nerve and a lesser splanchic nerve. They come out, they synapse in these collateral ganglia, and that's most of these fibers in this region here. And then down here are the lumbar splanchic nerves. So that's what that's talking about for the splanchic nerve. So there's greater, lesser, and least splanchic nerves, a lumbar splanchic nerve, and also a sacral splanchic nerve. So like I said, these ones are the ones that are mostly doing those collateral ganglia. So then splanchic nerves interweave, forming abdominal aortic plexuses. So that's these little plexuses we see right here. So there's a celiac, superior and inferior, and then that leads to the abdomen and pelvis. Then pathways to the abdomen. So these postganglionic fibers can serve the stomach, intestines, liver, spleen, and kidney. And then to the pelvis. Mainly, I talked about all this already, but these preganglionic fibers originate from T10 to L2 and travel the trunk to the lumbar and sacral ganglia, and they serve distal half of the large intestine, so urinary, so here showing them down here, urinary bladder, and reproductive organs. They primarily inhibit activity of muscles and glands in the abdominopelvic visceral organs because when you're in fight or flight, you're not worried about digestion. So then, remember, we have the adrenal medulla, and this is sympathetic, and this is the gland. So if we had the kidney here, that's a horrible kidney, but this is the adrenal gland sitting on the superior portion of the kidney. Sometimes this is called the suprarenal gland. It's just easier to say adrenal gland. But in the middle of that, we have the adrenal medulla. Think of that as a misplaced collateral ganglia. So adrenal medulla can be considered a misplaced sympathetic ganglion. So these preganglionic fibers release neurotransmitter here. There are then cells sitting in here holding epinephrine and norepinephrine. When this neurotransmitter gets there, they release those products into the blood and then can travel through the vascular system to have their effect. So then with this, last chapter we talked about somatic reflex arcs. Now we need to talk about visceral reflex arcs. Your organs also have reflex arcs. So they have the same components, a receptor, sensory neuron, integration center, motor neuron, and effector. So they have to perceive, the sensation. They have to send that sensory information, they have to integrate it, and then send the effector. Two key difference, visceral reflex arc has 2 consecutive neurons in the motor pathway though, whereas somatic, of course, has that 1. The afferent fibers are known as visceral sensory organs as well. So examples of visceral reflexes that empty the rectum and bladder, and then this 3 neuron reflex arcs exist in walls of the GI tract as well. They involve what's called the enteric nervous system. Enteric nervous system is pretty cool. It's made up of sensory neurons, interneurons, and motor neurons, and it's massive. It's sometimes referred to as your gut brain. So here, just showing how this works. Signal sense, going through the dorsal root ganglion, interneuron, lateral horn here, out, autonomic ganglion, and back out to the effector organ. So we pretty much just added this part here for that visceral sensation. So now I talked about the neurotransmitters and how they could differ and how they could cause either an activation or inhibition. So the major neurotransmitters are acetylcholine and norepinephrine. So these ones here, acetylcholine, so choline, are used by somatic motor neurons, is released by cholinergic fibers. So if a neuron releases acetylcholine, it's referred to as a cholinergic fiber. So all autonomic nervous system preganglionic axons and all parasympathetic postganglionic axons except sweat. Oh, wait, not that one. That's this one down here. I got ahead of myself. This one is except, I already have it written, except sweat glands. There's that asterisk we drew before. I got ahead of myself. Norepinephrine is then released by adrenergic fibers. So norepinephrine, so this one you just have to remember, sometimes is referred to as noradrenaline. So that's where, or adrenaline, this is where it gets this name, adrenergic. So all sympathetic postganglionic axons except sweat glands. So the effects of neurotransmitter depends on whether it binds to a cholinergic receptor or adrenergic receptor. So we're going to talk about those a little bit. This is just a little reminder here. So all these are norepinephrine except sweat glands. And then all these are acetylcholine. So these ones would be adrenergic. These ones would be cholinergic. Most of these are cholinergic fibers. These ones right here are the adrenergic fibers. So then let's just focus on the cholinergic receptors. Remember, cholinergic is related to that acetylcholine. There are two different types. Remember, these can be activating, or positive, or inhibitory, negative. So what makes it excitatory or inhibitory? So we have nicotinic receptors and muscarinic receptors. In their name, that's the drugs that bind to them and mimic the acetylcholine effects. So nicotine and muscarine, mushroom poison, bind to these receptors. So let's think about being that cell. What could cause excitatory effect? What could cause an inhibitory effect? So if we're a cell membrane right here, and we're, let's a nicotinic receptor, acetylcholine is released, binds to this, bind to there. So this is inside the cell. So this is negative, and this is positive. Let's say it's, minus 90 millivolts, comparing inside and out. So what would make this excitatory or inhibitory? It deals with the ions that can move out. So when we depolarize something, we would be moving a positive ion in. So this would be something like sodium, maybe potassium, calcium, maybe also potassium, very rarely though. So that would depolarize it. Moving positive ions in would depolarize it. Another thing that could happen would be this could go through a down, or it could, I guess this could release negative ions. So one major negative ion is chlorine. So if a chloride ion leaves negative, this would also cause a depolarization. It would reduce the negative charge inside. So that can happen too. These are called chloride channels, and it could lead to that leaving. The other thing that could happen here is a secondary effect. So let's say acetylcholine binds here. This is a G protein coupled receptor then, leads to a secondary messenger, and then causes the smooth ER in the cell to release calcium, or causes calcium to come in through another activation mechanism. That would also cause depolarization because we're getting calcium in here. It would bring that charge back to zero. But now, so that all these examples I just drew were examples of excitatory effects. These effects could also be, draw the membrane back there, accidentally deleted it. They could also be inhibitory. So think of anything that could inhibit, we'd be sending positive ions out. We'd be bringing negative ions in. So if we bring negative ions in, we would hyperpolarize. So here, hyperpolarize, and positive depolarizes. So you have to, put your mindset thinking about the charge difference that can happen when you bind these receptors. So we're going to go through a few of these examples now, and it all depends on that receptor. That receptor might allow one ion in, might not allow another ion in, or might bring an ion out. Might be positive, might be negative. So that's all it depends on. So let's look at some of these. So nicotinic receptors are found on all postganglionic neurons of sympathetic and parasympathetic. So hormone-producing cells of the adrenal medulla also have these as well. So when acetylcholine is released, it binds and it can release a norepinephrine or epinephrine. Sarcolemma of skeletal muscles at the neuromuscular junction, of course, has these nicotinic receptors as well. So this is always stimulatory on nicotinic. So it opens ion channels, depolarizing the postsynaptic cells. So here acetylcholine binds, opens this, and there's, sodium, potassium, or calcium coming in, or maybe a slow outflux of that potassium that can happen in skeletal muscle. And then muscarinic receptors are the ones that could be inhibitory or excitatory. So this depends on the receptor type of the target organ. There are a few different muscarinic acceptors. They're labeled M1, M3, M5. So M1 through M5. So M1, M3, and M5, you don't have to know these, but these are all stimulatory. The inhibitory ones are M2 and M4. So what I talked about, that G protein coupled receptor, that's kind of what these ones do. So here, acetylcholine binds, goes through this receptor, causes calcium release. So that would be a depolarization. Whereas these inhibitory ones decrease the cyclic AMP production, which actually causes an inhibition of calcium release, which would be hyperpolarization. So that's how it could affect the two different things there. So now continuing here, looking at these interactions. So most visceral organs have dual innervation, meaning they can work together or against each other. So this is called an antagonistic interaction. So they work to precisely control visceral activity. So both ANS are partially active, resulting in basal sympathetic, parasympathetic tone on your system. Right now, you have a basal respiratory rate and heart rate that's having dual innervation from the parasympathetic and sympathetic system. Now, depending on the state, you either increase one or decrease the other. So one division usually predominates, but in a few cases, divisions have a cooperative effect. So this allows for precise control of visceral activities. So sympathetic division increases heart and respiratory rates and inhibits digestion and elimination, whereas parasympathetic decreases heart and respiratory rates and allows digestion and discarding of waste. So there's a good matching section on the virtual lab that talks about all the different examples of the parasympathetic or sympathetic systems and what they do. Think about when you're wondering, would this action be parasympathetic or sympathetic? Wonder if it would be something you would require during rest or digest, or something you would require during fight or flight. So almost all blood vessels of smooth muscle is entirely innervated by sympathetic muscles only. So this division controls blood pressure even at rest. So it depends on how much sympathetic output there is. So this is called vasomotor tone, continual state of partial constriction of blood vessels. If blood vessel drops, so you stand up too fast, sympathetic fibers fire faster than normal to increase constriction of blood vessels and cause blood pressure to rise back up. If blood pressure rises, the sympathetic fibers slow down, and that causes dilation. It allows sympathetic divisions to shunt blood where needed, like to your skeletal muscles. And then here, the parasympathetic division normally dominates heart and smooth muscle, digestive and urinary tract organs, and it activates most glands except for the adrenal and sweat glands. So a lot of important parts of the endocrine glands, tears, and so forth. Slows the heart and dictates normal activity levels of digestive and urinary tracts. And these organs also exhibit parasympathetic tone. So always slightly a little active. The sympathetic division can override these effects during times of stress, though. So drugs that block parasympathetic responses increase heart rate and cause fecal and urinary retention because you're not doing that rest and digest anymore. And then cooperative effects. Best example of this is between the two divisions seen in control of the external genitalia. So parasympathetic effect cause vasodilation and are responsible for erection, and then sympathetic fibers then cause ejaculation, males, and reflex contraction of females' vagina. So it's a cooperativity effect between the two divisions. So don't always think of these as antagonists to each other. There are times when they do work together. So unique roles then of the sympathetic division. Talked about some of these, but the adrenal medulla, sweat glands, and rector pili muscle, kidneys, and almost all blood vessels receive only sympathetic fibers. So they have a thermoregulatory response to heat. So if you walk outside and it's hot, you begin to sweat. So you dilate skin blood vessels, allowing heat to escape and activate sweat glands. When it drops, vessels constrict, and you might begin shivering. This system is also releases renin from the kidneys. So renin is an important thing for long-term regulation of blood pressure that we're going to talk about in the blood chapters coming up later. So it causes the release of renin from the kidneys that in turn activates the system that increases blood pressure or blood volume. It's called the renin-angiotensin aldosterone pathway. And then metabolic effects increases metabolic rates of cells. You're going to be using a lot more ATP, so a lot more glucose is available. So it raises blood glucose levels and mobilizes fats for use as fuels. And then localized versus diffuse effects. So think about the release of norepinephrine into the blood at the adrenal medulla. So that's very wide effects. Whereas the parasympathetic, those ganglia are directly on organ they innervate, so they're very localized. So parasympathetic division tends to elicit short-lived and highly localized control. Acetylcholine is quickly destroyed by acetylcholine esterase. Remember, this is the enzyme that breaks down acetylcholine, if you remember that from the muscles chapter, or skeletal muscle contraction. The sympathetic division tends to be longer lasting with body-wide effects. So norepinephrine is inactivated more slowly than acetylcholine and can be diffused throughout all the cardiovascular system. So from the adrenal that have prolonged effects that last even after sympathetic signals stop. This is why after an immediate scare, it takes a little bit of time to get your heart rate back down and get relaxed again. So then clinically, here's something called autonomic neuropathy. This is damage to the autonomic nerves that is a common complication of diabetes mellitus. The early signs include sexual dysfunction. We just talked about that cooperativity effect. So other frequent symptoms include dizziness after standing poorly, so it's poor blood pressure control, urinary incontinence, sluggish eye pupil reactions, and impaired sweating. So like I said, those pupil reactions isn't always drug-based. Best way to prevent diabetic neuropathy is to maintain good blood glucose levels. So be careful of the amount of sweets you eat. So now we can look at the control of the autonomic nervous system. I hinted at this earlier in the chapter, saying how the higher order brain centers can control this all. So the brainstem and spinal cord, hypothalamus, and cerebral cortex are all controlling this autonomic nervous system. So the hypothalamus is generally the main integrative center of the autonomic nervous system. So hypothalamus, remember, it's right here. So right there's the thalamus, and then right here is the hypothalamus. This is known as the boss of the autonomic nervous system. So a lot of the regulation comes through here. And there is some limbic system or emotional input that affects it. So, think about that in terms of stress, vision, looking at something, seeing someone's face having an expression of fear or anger, and you might feel threatened by a facial expression. You'd have that visual input coming in. The limbic system would realize, oh, that's a face I should be scared about. That's a threatening face. That then sends the signal out, and then that regulates heart rate increase and so forth. So it's kind of neat how it all works together. Or, you see a skunk and to activate your fight or flight response when you visually see a skunk, because you have these association centers that tell you skunk stinks, skunk bad, get away from skunk. So simple way to describe it, but it works. So it works through the limbic system structures on hypothalamic centers. So here, just going through a little more, I talked about some of this, but the brainstem reticular formation appears to exert the most direct influence. So here, that RAS, reticular activating system, regulates pupil size, heart, blood pressure, airflow, salivation, etc. So there's a lot of spinal reflexes in this region here as well. So there's some chemoreceptors in here monitoring the levels of CO2 in your blood. So you have your respiratory centers or respiratory control centers that, well, CO2 gets too high, you then activate faster breathing. So a little example there. We'll talk about that more we already talked about that in the respiratory system. Respiratory system was the end of ANP1. So remember, we have those centers there. And they can, if they detect a high amount of CO2, they activate and increase the respiratory rate. And that's an autonomic response. Hypothalamic controls, again, this is the boss. As we said, control may be direct or indirect through the reticular system or the spinal cord. So centers of this control: heart activity, blood pressure, temperature of body. So if you release something called pyrogens, when you get an infection, they go to the hypothalamus, change your body's thermostat, and then cause a fever. This hypothalamus says, I want my body at 103 degrees Fahrenheit. You then begin shivering, to raise your body temperature. And then after that fever is done, your hypothalamus is like, oh, I want to go back down to 8.6 then. And then you sweat. And that's why fevers are those cyclic things of shivering and sweating. So emotional responses are activated through the limbic system as well. Rage, fear, pleasure, and so forth. Activate the fight or flight system. Cortical controls then, so cerebral cortex. So voluntary cortical controls some visceral activities as possible. Let's take some training. So awareness of physiological conditions with goal of consciously influence them. So biofeedback training allows some people to control migraines and manage stress. Very interesting. And then last thing here are some disorders of the autonomic nervous system. We all know about hypertension. So these are all involved deficient control of smooth muscle activity. So hypertension is high blood pressure. This is an overactive sympathetic vasoconstriction response. So heart must work harder to pump over that blood pressure gate to come out the aortic valve. We're going to talk about that more in the heart chapters. So artery walls are subject to increased wear and tear, but can be treated with adrenergic receptor blocking drugs. Raynaud's disease is in a painful, exaggerated vasoconstriction in fingers and toes. So digits turn pale, then cyanotic. This is then treated with vasodilators. And then autonomic dysreflexia, life-threatening, uncontrolled activation of autonomic neurons. So this happens in quadriplegics and people with spinal cord injuries above T6. So blood pressure can skyrocket, posing increased risk for stroke. So like I said, this was a shorter chapter. Sorry if you're hearing some dogs barking in the background right now. I think our roommate is getting home, but that's what happens when you have to record things from home. So if you have any questions, feel free to reach out to me or write them in the comments, and I'll get back to you as soon as possible. But with that, I hope you all have a great day, and bye-bye.